All right. All right. So, good morning and thank you for coming to be part of our pioneer group. Um, yes, exactly, Michelle. Raise the roof. Um, we're gonna just cover some of the basics of what's going on. As I think we have made clear, we have finished the pilot, and now we're doing what we call a phase one rollout, where we've got, are we currently back up to 10, Michelle?
I think we're at 9.
Okay. Of practices from around the state who have asked for a training on the dementia friendly dental practice. And so we have, as you've all probably seen, have Michelle and Colleen with us today, who helped form and create this. Michelle's the coordinator behind all of it. And they each did a recording of a practice session so that you can see what delivery looks like. And now we are going to teach you how to do that same delivery. And Colleen is going to be training those 9 practices that are set up between August and October. But we're going to try to make it so that if you would like to attend, that we could get some of you, probably no more than 2 people per training in person. And then also there is Colleen's doing one of the trainings virtually, so we could have you sit in on that. Otherwise, if it doesn't work, as you know, there are 2 videos, so you can watch the other video that you didn't watch in preparation for this. So I am Jen Rooney, and I am the head of ACT on Alzheimer's, and I would like my colleagues, Michelle and Colleen, to introduce themselves and give you their roles in this fabulous project. Michelle, you want to go?
Sure. I'm Michelle Barclay. I worked for many years at the Alzheimer's Association here in Minnesota, North Dakota, but before that in Los Angeles, California. I have been working with people with dementia and their families as an educator, a program developer for 30 years, almost 30 years. Wow, it makes me feel old and wise. So I have been a consultant on this project, very happily so.
And my name is Colleen Fritsch. I have been part of the Dementia Friends program for the last 6 years. And for the last 10 months or so, Michelle and Jen have been kind enough to let me be part of this Dementia Friendly at Work for Healthcare program. And it has just been like a little frosting on my cake to be part of this. Before we get started, I have a couple of real quick questions for you. And so you're going to see a poll pop up with just 2 questions. I want to know how many of you have ever attended a Dementia Friends information session, and how many, if any of you, might be trained as a Dementia Friend champion. So if you could just respond to that poll, that will kind of help us going forward. Very cool. So all of you, yay, have attended a Dementia Friends information session, and 2/3 of you have been trained as a Dementia Friend champion. So I will just keep that in mind as we go through today and try and reference some of this material to what we do as Dementia Friends, where it's similar and where it's not. So thank you for that.
Perfect. Thank you. I'm just going to start here, just making sure we're all working from the same place and have a little background. So the Dementia Friendly at Work sector guide lists healthcare, and that is exactly the portion of the sector guide that this training is addressing. And thankfully, Dementia Friendly Dental Practice Initiative was led by the University of Minnesota and Trellis in collaboration with the Minnesota Dental Association and the Barclay Group. There's been a lot of fabulous people working on this, but you may ask, why dental practice first? And the simple reason is that's where we got the money. Delta Dental gave us a nice big grant to help create this curriculum, okay? And I think it's for all of us, I think, well, I shouldn't say for all of us, but for many of us, going to the dentist can be a really anxiety provoking event. And now think about that if there is cognitive impairment. And so the fact that Delta Dental was willing to help us, give us money to put this together, it is a real blessing because the Minnesota Dental Association got all over it. They're involved. And we've got Dr. Steve Schumann, who is a professor at the University of Minnesota Dental School, who's just a gem, who is really committed to this and is working with Michelle and I on this all the time. And he is kind of the person in charge of the advanced training, which is about 6 hours in length. And it is the clinical training for the dentist and the hygienist. And today's session is basically on the basic training for the entire dental practice. Okay, so that's everybody from the receptionist to the accountant to the hygienist, the dentist, everybody involved. The goal of this is to increase the number of dementia-friendly dental practices in Minnesota by offering information to the clinical and non-clinical staff on Alzheimer's disease and dementia, ways to effectively communicate with and support cognitively impaired patients, and give you tips for creating a dementia-friendly clinic environment and practical case studies. So I think that's what makes this work so crucial. It's practical, and we can all make a difference in our communities, right? The root of this new curricula is the Dementia Friends and Dementia Friendly at Work curricula, which have been adapted for dental care and more broadly, other healthcare settings. So that's the exciting part, is that once we get this launched and we're all feeling comfortable, then it's going to take very little change to be able to use the same training in all healthcare settings, not just dental practice. Michelle, do you want to talk about the phases of this work we're doing?
Sure. So we've already finished the pilot phase. We piloted in 2 dental practices. Colleen was the trainer in one and Rachel Von Ruden in another. We piloted in 2 clinics this spring, and based on the feedback, so we actually delivered the hour and a half full training, and then we got feedback from people about what they liked, what was strong, what was weak, what they wanted more of. And then we took that feedback and integrated it back into the curricula. So the materials that you were sent actually have been edited multiple times, including after the pilot. We roll into the next phase of the project, which we call the initial rollout, or phase 1 initial rollout. So this is what Jen mentioned earlier, where there are 9 clinics across the state who will receive this training from Colleen between August 31st and October 31st. And then we will look at all that data again. We're not going to do a focus group, but we're going to do a survey. And I will look at all the data, and we'll take that feedback and see if there's anything we need to do to polish this diamond just a little bit more, see if there's any rough edges. We'll polish it up. And then we're going to move into phase 2, which is the full launch of the program, which we're expecting beginning in January 2022. So right now, where you are is the pioneer crew. You're like on the wagon. championing the wagon. And so we're bringing you in now so that you can be a part of this experience and you can begin to see what this looks like in the field as well and online. So what you can expect is that for now, we're going to give you everything we have after phase one, or after the pilot. We're going to go through phase one together, and then we'll make the final changes. And then there may be some tweaks to what you're learning today that we'll update you on before you're fully launched and ready to start scheduling for January and beyond 2022, your own trainings in your own communities. I kind of did your part too, Jen. I'm sorry.
Oh, it's all good. We're all in this together. So I'm just breaking down the timeline. Okay. So July, which we just finished, the materials were finalized and the Zoom trainings were recorded. So just a reminder, everybody should have received the links to those trainings. That 1 stars Colleen and 1 stars Michelle. And if you haven't received those, please reach out so that we can get those to you. And you were also given links to the materials, the trainer guide and the participant guide, the PowerPoint, if you choose to use it. In those videos you already saw, Michelle did use it in her presentation, Colleen didn't. That was intentional. We want you to know that you can deliver it both ways. And then the 4th link that you were given in materials was the case studies. So those are the materials you should have access to. And if you haven't received access, please let us know. Today is this basic training. And then, as Michelle just said, from August 31st to October 31st, we're going to have those 9 trainings around the state that Colleen will be leading. And hopefully you can participate in as a viewer and audit those classes. The November phase 1 is going to be done, and we're going to analyze it and polish the diamond. And November to December is when we're going to begin scheduling trainings in the new year. So that means it is going to be January before it gets launched, and you will be deployed out to clinics around the state. The one thing that I'd like to mention right now that I think could be not confusing, but hopefully that we will have streamlined for you. One of the hesitations in all this is that we know you want to know, how do I register? How do the clinics get registered? And how do we get CEUs, those types of things. That is being developed right now on a website. Julie Rolls here at Trellis is working with another web designer, and it's going to be similar to the Dementia Friends portal, where you can register for a session, and then once you become a master or a champion, you can sign up in that tier of the portal, and then even for the train the trainers. We are trying to get that exact same technology working on this, and so that is one of the reasons why we're not going to get fully into that today. And the other thing that this portal will hopefully do is allow dental practices to register and say, hey, we don't have a trainer, but we're looking for somebody. And somebody to say, I'm a registered trainer and I can help out in this area. And then we will do the match and get people working together. And then trainers will also have the option of saying, maybe Kelly says, hey, my dentist in Mankato would like to do this and I'm willing to do it. So we're trying to make sure the website can let you register a practice and say, I'm going to train it, register yourself as a trainer, and let dental practices register themselves as wanting to be trained. So that part isn't complete today. It will be by October 7th. And that is the date of our community summit. And you should have all received information on that. The Act on Alzheimer's group is doing, we didn't get to have a community summit last year because of COVID. So we're doing a virtual one this year on October 7th. It's a Thursday and it's going to be from 9 to 1. And one of the main focuses of the meeting will be the dementia friendly dental practice. So you're going to have the heads up. People around the state are going to be learning about it. You pioneers are already going to have a pretty good feel for what it looks like. And hopefully all of us will get to see the website ready to roll on that date. What else have I forgotten? Michelle, why don't you talk about, or did I just steal your thunder?
No, I think that's great. I think that what you did was perfect. Essentially, you'll be able to begin scheduling trainings in November and December for 2022. So you have some time to learn the curriculum and to get comfortable with it. The tools that will be developed on the website will be ready for you, at least by, if not on October 7th, by November. Jen's always more optimistic than me. I'm hesitant, but they'll be ready. This website's going to be great. I wanted to let you know that initially there was a letter sent by the Minnesota Dental Association to dental clinics across the state asking them if they wanted to be part of this pilot. This is how we got these initial sites. And I expect that we could send another letter out through the MDA that lets people know about the launch and how to get involved. And so I suspect that we'll be doing some marketing through the Minnesota Dental Association of the availability of this training. And also we'll be giving you some tools. So templated letters for how you might reach out to a dental clinic, what you might say, knowing that they probably already have received something from the Minnesota Dental Association and more than once, hopefully, so that they're kind of understanding that this is out and about. And also you'll have like a template email that you could send, or a template letter that you could send that introduces yourself. I mean, you could of course add to it, but just explains what this is and offers to come in and do the training for their team. So you'll have some tools like that too, which will be on the website. And just so you know as well, that there'll be a presentation on this program and a delivery of this program at the Star of the North Dental Conference, which is in May of 2022, which should let even more dentists know that this is here. And people may go to the session and then realize they want somebody to come and actually train them at their practice itself. So yeah, so that's what we're doing to get dental clinics involved right now.
Awesome.
I will say one other thing is that, you know, I've worked a long time trying to get healthcare clinics more dementia capable. And it's always felt a bit like a fight. It's felt difficult and hard to get in. And really the struggle is real. That's what I'll say about that. What I would say about my experience working with dental clinics is that much more open, much easier to work with, really enthusiastic about the material. And maybe this is because we're getting the early adopters like you guys, the pioneers, but it gave me a lot of hope for especially in small communities, to be able to reach out to explain. I mean, many of these communities are already experiencing challenges with these populations. I reached out to several clinics who said, there's an assisted living down the street that just opened. We're getting all of these clients. We have no idea what to do with them. So I think that this is a great time to be including dental practice into our dementia-friendly communities, and a great way this curriculum is a great way to open the door to that relationship.
Boy, you said that absolutely beautifully. That is what I have found too, that people are really open to it. And that, again, the thing I like about it is it seems to be, as long as we can get people trained from all over, it's inclusive. Every community can be reached by this. And I don't know if I should say this. I do hope that the dental practices being early adopters helped pressure some of the other healthcare facilities to adopt. I'm hoping that those positive experiences will resonate in the communities. That
Ladies,
said, I'd like to introduce Colleen because she is going to review the materials with you. Yes, Kelly has a question.
there we
Well,
go.
I just wanted to share that I have put this out there, Dementia, the Friendly Dental Practices, to a local network of senior providers, and they were so excited. So I think that the pressure will come from that side as well. So that, that was really, their response was really great. Their secondary response is, we really need this in our emergency rooms. That can be one of the most challenging places. So I did share that, this was the initial step to trying to then generalize the importance of this. But I think we have a lot of folks out there who are going to be really supportive of this. So I'm really excited.
That's great. Thank you for adding that, Kelly. I think I told everybody in your emails that hopefully you had an opportunity and could print out the participant guide and the trainer guide. Otherwise, if you have two screens, you might be able to pull it up, because Colleen is going to review the whole delivery process with you right now. So now is the time to pull out your materials, and I'm handing it over to the world's greatest dementia-friendly presenter, Colleen Fritsch.
Hi, ladies. I hope you are as excited about this as I am. We are incredibly fortunate that we have Delta Dental, the University of Minnesota, and the amazing Michelle Barclay behind putting this curriculum together. Talk about polishing a diamond. They took a chunk of coal and have created what I think is a very practicable, impactful curricula. When I presented this the first time, it was like watching light bulbs go off in the room as they became empowered to not just deal with people with cognitive impairment, but successfully deal with them, and with grace and friendship. And so I hope you will all have the opportunity to experience what I did. And I appreciate that the University of Minnesota and Michelle are bringing their metrics to this and doing an analysis as we go along, so that we can be sure that this is the effective practice we want it to be. So let's go through that champion's guide. Sorry, trainer's guide. I'll get used to that word, no problem. So the first 6 pages of that trainer's guide literally walk you through step by step how to set up a presentation, how to work with the dental office, how to follow up with the dental office, how to confirm the space. It also gives you tips for doing this in virtually. So it gives you those first 6 or 7 pages, literally walk you through that. And for those of you who are also Dementia Friends champions, it is very similar to that. And I think those of us who are champions have learned to become very confident in that manual. And this manual does that in much the same way. So it gives you setup, in person, how to do the sign in. And then I want to do some tips on this curriculum, especially the ways in which it is different than Dementia Friends, so that you can begin to see how this rolls out in a different way when we're dealing with a group that are doing this for professional growth. It's different than a friend and neighbor just wanting to reach out. So the first section is the the welcome. And it starts with your buy-in, just like Dementia Friends does. This is why I'm doing this. This is why I think it's important. But then it acknowledges their buy-in. It goes into, some of you may know someone living with Alzheimer's or dementia. Some of you may have already had training with someone with Alzheimer's or dementia. And some of you might be here because your employer told you it's important. And so you're acknowledging wherever they are in their buy-in as well. And that becomes important as we get to the next step. So it's your buy-in and their buy-in. And then you go to the definition and the facts. So we're going to, in that section, we're going to talk about what is dementia, and we're going to do the one word for dementia. And since you've all at least been to a Dementia Friends information session, you probably remember that very important part. I'd like to ask, as we say in the session, I'd like to ask 3 to 5 of you to share with me one word that comes to mind when you hear the word dementia. And just like you did in the Dementia Friends session, when people shout out that word, you shout it back to them for 2 reasons. Number 1, so they know you heard them. And number 2, so that anyone in the room who didn't hear that word that was just shouted out can understand, gets to know that word as well. It also, by the way, creates a sense of relaxation. Even if I'm one of 20 people and someone says confusion and someone says frustration and someone says lost, as a person who's sitting in that room quietly, those thoughts are probably going through my head as well. And now I'm feeling comfortable that I'm not the only one who has anxiety or tension around dealing with someone living with dementia. When I do this poll, when I do this section virtually, I create a poll like the one you just saw a few minutes ago. And I ask everyone then to chat. Oh, sorry, it's not a poll, it's a chat. I ask everyone to chat with me one word that comes to their mind when they hear the word dementia, and I give them permission, even if somebody else has already used that word, go ahead and use that word. And again, as it's scrolling up my screen, I can say frustration, confusion, grandma, loss, whatever those words are. And again, it creates that atmosphere of we're all in it together. In this presentation, we ask the people in attendance if they would give, let me finish with the one word. And then at the end of the one word virtually, I do a poll. Were these words mostly positive or negative? And I put that poll up much like the poll that you saw earlier. And then we move on from there. When I get to the part when I say, can anyone tell me the difference between dementia and Alzheimer's? Just a little caveat, be prepared for someone to say the wrong thing. As hard as we have all worked for the last decades, there are still people who infer dementia as senility, as in just a normal part of the aging process. And so you need to be prepared for that and graciously thank them and say, I hear that, or whatever you want to say. I've heard that a lot, and I can understand where that's coming from, but dementia is, and then go into it's an umbrella term for diseases of the brain. So just because in this curriculum, you're going to give them the opportunity to answer that question, be prepared for someone not having the right answer, even though most people will. Well, you know, you and I live in a dementia-friendly world, so we just kind of assume now that everybody gets it the way we do, and they don't. So be prepared. And then last, I love the section where they do the facts on Alzheimer's and dementia. We don't do that in a Dementia Friends presentation, but when they do those facts around Alzheimer's and dementia, they literally bring it home so that it goes, so if you're seeing 10 person a week, that means that you're seeing 10 people a day, you're seeing 50 people a week, if 20% of your population is over the age of 60. And they bring it home to the receptionist and to the dental practitioner. And I think that now we've taken their buy-in from the beginning, when why are you here, to now understanding that this presentation, this next hour of their time, is going to impact their everyday interactions with the older adults that come into their dental practices. The next section that we go through is the 10 signs of Alzheimer's or dementia. And for those of you that are dementia champions, you know, we have our way that we like to present that, set it on the shelf. Because this is a totally different way of presenting those 10 early signs and symptoms. This is, here's the sign or symptom, and here's how you might see that in your practice. And that's really, really helpful to them because this is still an abstract concept, but now they're starting to put it together. When Michelle and I did the very first one, there was a group that suddenly had an aha moment when we went to the visual changes, because they had a lot of older adults who would walk into a pole that was right in the middle of the office. You were supposed to walk around this pole as you went back to the dental practice chair, but the pole was painted the exact same color as the wall. And so people were walking into it and they could never figure it out. And so now I'm sure by now that pole in that dental office has changed its color because it just made sense to do so. So this is a new way of presenting the 10 early warning signs, and it's an impactful and powerful way as we're walking through this journey. That said, it's a lot of talking. Going through those 10 early signs and symptoms of Alzheimer's or dementia, that's like 10 minutes of just you going blah, 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 and it can get kind of mundane. So my recommendation to you, and Michelle and Jen didn't know I'm going to say this, my recommendation to you is break it up with a story. Break it up with a story and maybe some humor, not a story, obviously, that makes fun of the person living with Alzheimer's or dementia, but a story that interjects some humor and kind of breaks up the lecture quality of that section, because it is important. When we do the communication tips, that's where we do the 20 seconds. It can take a person living with Alzheimer's or dementia up to 20 seconds to understand what's being asked of them, formulate the response, and articulate that response. When I do that, whether I'm doing it here at my home or I'm doing it out in person, is I have this lovely clock that I bring with me. And I don't know if you can hear it, but it has a really loud tick. And so when I present in person, I just keep it behind me somewhere so I can count off the 20 seconds. Because in the meantime, then I'm looking like I'm trying really hard to think. I'm making a face that says, this is important to me, I'm working on it. When I used to do it and I'd look at a watch or at my cell phone, then that was what I was focusing on, and not the confusion and the struggle of the person living with Alzheimer's or dementia. So that's just my little off the road tip. Another tip about that is, when you're asking someone this question, try not to make it a question about what did you do last night, or did you have a lovely time last weekend? Because for a person with short-term memory loss, that's probably already gone. 20 seconds isn't going to be enough time. But do you have any plans for this weekend? Or do you think the twins will ever get the second half of the season together? Or any sort of question that is future oriented rather than something about what has happened in the past. When you get to the planning activity, take some time to set that up. Otherwise, you're going to give them 5 minutes, 10 minutes to work on it, and they're going to spend a lot of time going through, well, I thought. For those of you that watched the videos that Michelle and I did, you'll see that she and I did that planning activity differently, and that's just fine. When Michelle did it, she said, imagine that you're coming into this clinic for the first time. What are the steps you need to take to register, get to the appointment, register for the appointment, and wait in the waiting room? Perfectly valid. But what she did was she gave them the starting point and she gave them the ending point, and they went from there. When I did it slightly differently. I said, imagine that you're answering the phone and you're going to have a new patient coming to your clinic. What are the steps they need to take once they enter their building to come into your office, register for their appointment, and sit and wait to be called? So I did it from the perspective of the receptionist. She did it from the perspective of the patient coming in for the first time. Either way, we got them to the exact same point of, you know what, this isn't as easy as we thought it was. People don't just walk in and wait for their appointment. There's a lot more going on with that. And so just take the time to set it up so that they know what it is you're looking for, so that they can then be successful and begin to walk themselves through the process. We're now at the more interactive part, and so you can kind of see them putting all of the pieces together that you've given them so far. So you've given them the 10 signs, you've given them the communication tips, the planning activity, they're starting to roll it in, and then you take them to the next level. Now that we know what we know, how do we reimagine our physical space? And so now it's starting to churn with them, and you can see it starting to churn with them. And this is where you begin to empower them. So you go through all of the physical space things, and you're going to see the head nods and the people talking to each other as you go through this, because you're talking about things in their physical space that they have never thought of before. And so then when you get to the end of that, be sure you've got some time for them to process, give you feedback, and then write down their ideas, because hopefully that's the beginning of where the dental practice is going to start. Once you leave, is they're going to start looking at their physical space and how they can change that. And so you want to give them the time. In the 60-minute version, now you just give them the resources and talk to them and recap what you've talked, and you move on and you're done, right? But in the 90-minute, we go one step further and we do a case study. And it's a very, very powerful case study. The ones that I have done are the ones where you present the case study to the entire team. So the receptionist is there, the bookkeeper is there, the dental hygienist is there, and the dentist is there. And you're going to give them a case study that really involves the interaction of all of them as a team. And again, it allows them to process, it allows them to see their work differently, see their work through the eyes of an actual individual that is in this case study. And they begin to see they do have an impact. They can, in the way they talk to people and the way they address people, they can have an impact in someone's sense of comfort in the dental office. Then we give them, after the case study or without the case study, we give them the resources that are available. Now, the resources that are available in the trainer's guide are the Alzheimer's Association and the Senior Linkage Line. And for those who want to learn more, we also give them the Act on Alzheimer's website. You might also know of a particular nonprofit in your area that has some expertise on dementia and might want to give them that link and that contact information as well. I just want to caution you to caution them about not overwhelming people. People living with Alzheimer's or dementia are doing their best just to stay afloat every given day. And if you give them information and give them information and give them information, they're going to drown and they're going to give up and they're not going to follow through. So when you give those resources to the dental clinic, just be careful about, give them that caveat to not overwhelm the people that they care about. And then at the end is the call to action, just like it is in a Dementia Friends session. So you're going to ask them to either chat in the chat feature virtually or to tell you what their action step is going to be for their dental clinic. And again, this becomes very empowering because now they're beginning to see, just like at the beginning, they saw they were all in this together in their one word about dementia. Now at the end, they're going to see that they're all in this together again in their willingness to and their ideas for making their dental practice a better place. And then at the end, there is whether you're presenting in person, you will hand out an evaluation, ask them to fill out the evaluation. And when you get that back, it will have their name and email address on it, and you will then send them the CEUs. If you're presenting virtually, you will then, after the session, send people the evaluation. And when you get the evaluation back, that is when you will send them the CEUs or the certificate of completion if they don't need CEUs. So that's kind of my in brief walkthrough of the trainer's guide. Can I open it up to you guys as and ask you if you have any questions about that particular section? So I'll take this part. I had two concerns when I first read this curriculum. As a Dementia Friends champion, I went, wait, where are the 5 key messages? But this is our diamond that we're spinning with a slightly different angle than Dementia Friends. And the 5 key messages are important to change friends and neighbors' perspective and worldview of someone living with dementia. Here we're talking to a professional group and approaching it from their professional standards. And so it's a slightly different twist. I would think if you would go through this again with those 5 key messages in mind, you would hear that they're there. They're just not articulated as the 5 key messages. And then the other thing that I went, wait, where's the bookcase story? The bookcase story is a game changer. Why isn't the bookcase story here? But the bookcase story is here. When we get to that page on communications, when we talk about as the disease progresses, they rely less and less on language skills and more on understanding body language, facial expression, and tone of voice. And you heard when I did that presentation, I said, this is probably the most important thing I'm going to say to you today. And I read it again. And that really is the takeaway of the bookcase story as well. So that's what I know. Does anybody have any questions on the curricula? All right, then I will turn it back to Jen and Michelle.
Colleen, I'll just say one thing. First of all, Colleen is really a really exceptional trainer and got rave reviews, of course. And I'm so grateful for her leadership and expertise. It's just, I've learned so much from Colleen, and I'm sure you will too as you watch these things. It's just been really amazing. I will say one difference in this audience, if you haven't ever gone into healthcare or medical practices to do training, is that these folks are pretty used to training being you go somewhere and someone talks at you for an entire hour or 2 hours or 3 hours. So unlike the general public, and even myself, who can't sit still for more than 30 minutes without an activity, these folks are more used to that this is how training is. And so I think for them, the 10 minutes of the 10 signs, while we are thinking, oh God, this is excruciating, I think for them, that's what they're expecting the whole time to be like, except for maybe the case study. And so I actually think it's a breath of fresh air for them to have these interactive things peppered throughout. So although it does feel long in the 10 signs in terms of you speaking, I do think if you're nervous about that they are more used to that than people who you're training for Dementia Friends, because that's how most professional training is. It's a talking head talking at you for however long it takes, however long the presentation is scheduled for. So I don't know if that's helpful.
I think it is. I think that's very helpful. One point that Colleen made that I'd like to just talk about for a minute. We did, as both my colleagues have said, we did the pilot experiences. And one thing we did for each of those, we did have information to give the dental practice about the Alzheimer's Association and the Senior Linkage Line. But then I did make sure that we had specific information for their community. Okay. And so to Colleen's point of not making it overwhelming, you don't need a laundry list, but it really does help. And it got positive reviews that we had community specific resources for their community. So all of you pioneers are people who are very aware of what those resources are in your communities. So you will probably want to prepare your own list to hand out or share at that training. And then, not to get too far off of topic, but I know Kelly McDonough had brought up the idea of sitting in the waiting room and about how, how do we help people who are maybe not being recognized as having cognitive impairment. Michelle and I have also handed out information on the Hidden Disabilities campaign. I don't know if you can see this super clearly, but this is a lanyard. There are other types of signifiers. Here's a pin. It's the sunflower. And this is a group that's actually based out of Pennsylvania, but they have created the Hidden Disabilities campaign. So when somebody's wearing that, it signifies that there is cognitive impairment or another invisible disability. Maybe they're hearing impaired, so that people clue in and understand that that person might need extra attention. And so I've been putting information about that in the We Act newsletter. I encourage you to look into that on your own. To give credit where credit is due, Roseville, Minnesota, their local ACT chapter has been kicking down doors and making this happen. And they have now made it where this is recognized at the Minneapolis-St. Paul Airport, and TSA screeners are all trained in it. So that if somebody is wearing that, it says to them, if I ask this person, has anyone touched your bag? And they reply, yes, they might have, they have to take extra steps and maybe be more patient and more clear with their questioning. And then caregivers who accompany people with that often wear a lanyard or a pin as well. They are working to get this accepted around the nation. But I just recommend, this is all a side note, that you look into the Hidden Disabilities campaign, because that could be something that could be helpful in helping medical professionals and business owners recognize. Okay, so the one thing I was doing while Colleen was talking and was getting some of this information ready to give you, Michelle, jump in if I have this wrong. I'm going to give you the dates of trainings that are set up and times, so that if one of these resonates with you as a place that you'd like to sit in on a training, you can reach out to us and let us know, and we can try to make that accommodation for you. August 31st from 11:15 to 12:45 will be in, Colleen will be in Arlington at the Forever Smiles Clinic. So if that's near you, or if you'd like to sit in on that one, please let us know. Let's see, then the next one it looks like would be Lake Sarah Dental in Rockford on September 7th, and that's 2 to 3:30. And I think you all understand that the 1 hour is the training, and then the half hour that I'm listing is the case study.
And that's a Zoom training.
That one is Zoom. Okay, so
Yeah.
that, thank you for clarifying that.
Yeah, that's the
Michelle.
one Zoom one. Mhm.
Okay. Then it looks like September 28th, there's one in Hastings at River Pines Dental. And that's from noon to 1. They are not doing a case study. Then we're getting into October. So Apple Valley at Dakota Dental and Wellness on October 6th from 7 a.m. to 8:30 a.m. for you early risers. And then the next day, October 7th, is our summit, our community summit. And then in Northeast Dental in Minneapolis is October 12th from noon to 1:45. And then on October 13th from 10 a.m. to 11:30 is Shatek Dental in Slayton, Minnesota. So those are, we've also got 3 other clinics. Yes, Colleen.
What happened to Duluth? I didn't hear you mention Duluth.
That is September 17th
That's what,
from 9:30 to 11.
Thank you for jumping in. This is what happens when I'm reading and writing and listening at the same time.
that's okay. It's
Thank-
just more outstate. So, you know,
Yes.
for the
Yes,
the
100%.
pioneers who are
Yes.
outstate, maybe the, you know, it's outstate, but on the east side of the state, but maybe that's more convenient for some of them.
Yes, and it looks like that training is 9:30 a.m. to 11. So September 17th at Piedmont Heights Dental in Duluth. And then there's 3 others. There's 3 others that are, it looks like they have agreed to do it, but we haven't found a date yet. Adrian Family Dental in Adrian, Minnesota, Moore Lake Dental in Fridley, and Edlin Dental here in St. Paul. Yes, I can send out that information.
There's also an additional one in Litchfield that said they were interested, but I never contacted them because of the distance
Okay, so
and lack of virtual capability. So Colleen, if you're interested in that, I can reach out to those people too. Or we can have the next round of trainers reach out to them.
yes,
So if we add that one, that makes the 10, which was our goal. So,
Yeah.
So I'm happy to go to Litchfield.
Okay, I'll reach out to them.
Okay.
on behalf of Litchfield, I'd say they're all going to be better for the arrival of Colleen Fritsch.
Oh, whatever.
All right. So with all that information being thrown at you, I just want to review for the umpteenth time, our process. So first off, everybody should have watched one of the videos, and hopefully you have. Secondly, was attending this meeting and or watching a recording of this meeting. So if one of your colleagues wants to be trained, this is how we will post this site and send it out too, so that you people have the ability to watch what we've just practiced together. And then the other thing is to attend one of the trainings that I've just listed, either in person or virtually for the virtual one. And if that doesn't fit in your schedule, and if we can't make that happen, then you can certainly watch the other video that you did not watch in preparation for today's meeting. Again, I want to make it clear, in those 2 videos, Michelle uses the PowerPoint, Colleen does not. Either route is acceptable. Feel free to use it if you find it helpful or not to. And so that PowerPoint is also a resource that you should have all received. And then the case study also is a resource you should have all received. October 7th, the summit, that is where I'm banking on, and Michelle says I'm too optimistic, but I really do believe we're going to be ready to go with the site as far as how people register.
We
So you
should have
know-
another poll. How many of you have ever had a website rollout happen on time? So this website, by the way, is going to be way more I mean, I love the Dementia Friends website. This one has better functionality to it, a different kind of functionality, because it's going to help with the matchmaking process as it helps with the scheduling process. So, but October 7th would be lovely, even if they can just kind of say, demonstrate this is what we're working on. But certainly before the end of the year, I am sure, confident this will be ready. Just saying.
There you go. I appreciate that. Isn't that great? Betty is saying she can help find virtual resources in Litchfield. Yes, anything you can do, Betty, that would be awesome. And Anne is saying, is the registration easy for one of these trainings? Do they sign up via email? No, they would reach out to me and I will send them the link. Okay. And Natalie says, will there be a link to the website form, the Dementia Friends website, multiple website and avenues to get access information, at least for me?
I can help with that.
Yes.
So just like the Dementia Friends website is really a subset of the Act on Alzheimer's website, this Dementia Friendly at Work for Healthcare registration and website will be another subset of the Act on Alzheimer's. So the parent has always been Act on Alzheimer's. We've just never used that. We've gone directly to Dementia Friends. So it'll be very, and again, it's the same web designer that's doing this. So I anticipate it will have the same feel and the same ease of functionality, but it'll be through Act on Alzheimer's, not a subset of Dementia Friends, because they're the same thing, only totally different.
That was great. Honestly, I appreciate you answering that. You were understanding the question better than I was. So thank you. And thanks for the questions. What other questions can we help you answer today? Well, if we really wrapped it up in an hour, then kudos to everyone. You can always reach out to me. I think you've all received my email 3,000 times, but it's jrooney@trellisconnects.org. And feel free to let me know. You are our pioneers. And that's Molly's asking about the October 7th summit. Yes, all of the AAAs should have already received information about it, but right now it's just been a save the date. The registration has not gone out for that yet. So we're just letting everybody know about the save the date for October 7th. And the registration, I believe Julie Rolls hopes to get out in a couple weeks. Thank you, Molly. If there's any questions you think of later, if there's anything we can do to help make this more accommodating right now, please reach out. Obviously, there's lots more to come and we'll have more specific details when that website is pretty and polished and finished and ready to show off. But for right now, thank you for your interest and your hard work. Colleen.
So is there going to be another, so I get it that we're doing this pilot through the end of October. Will we be getting this group together in November and December before the January launch to just review any changes that have been made? Or are we just going to simply do that via email communication?
I think we're going to look to see how complex it seems, like how, if it's as simple as we hope it is, then it shouldn't be a big problem. But if there's any type of question, yes, by all means, we'll reassemble, and there'll probably be other people to train, you know, wanting to review all this. So yeah, I think you can expect more communication after the summit.
Natalie just posted a really good question that I will leave to Jen and Michelle to answer.
Oh, I think you were asking about, do we need proof to participate in presentation? Right now, no, because you're the pioneer group and you have been chosen. I mean, you've come to us specifically through a trusted field, right? So the answer is no, we don't need that right now. However, once the site is up, yes, we're going to want to have people registered as trainers, but right now, no. Does that make sense?
Yeah, I think it helps. This is Natalie. Basically, I was asking, like, if we can't participate in one of the events because you'll know we're there and have to watch one of the other videos, do we need to show you? But it sounds like you answered my question anyways. At some point, we'll have to be registered.
Yeah. You know,
okay.
We, just so you know, when we were talking about this, Michelle and I were actually trying to come up with the process, right, of getting everybody prepared. And, you know, it's about your comfortability, you know, just making sure that everybody feels like they've seen it, they understand it, they're confident in presenting it. So we're kind of just putting up these hoops more or less to make sure everybody feels confident. Because as I said, you have all been chosen by your communities as somebody who has shown interest and done trainings in the past. We just want to make sure that you're up to speed and feeling ready to do this, and we're not throwing you off the dock, right? We're wading into the water. But excellent question. And I'd also like to say, Natalie was so helpful to us when we were going to do our training in Cambridge. She works for the Central Minnesota Council on Aging. She got us those Cambridge resources, like, here's who you talk to, and it was really beneficial. So thanks for being the expert on your area.
Sure thing. I don't know if I'm the expert, but at least we have a list of connections, right? But sure, anytime.
All right. Are there any other questions? If not, Colleen, any parting thoughts? Michelle, any parting thoughts?
I hope as you get comfortable with this curriculum, you can see next steps. It is not going to take much at all. In fact, change the case studies and we're ready to go to our local clinics and healthcare providers with this, in my opinion. And I think it's just the beginning of making a very stressful situation for people living with cognitive impairment so much easier with just this little bit of information. So I hope you can all see that as I have seen that, and I am very excited to be part of this.
And I would just say thank you so much for being pioneers, and for standing up and being part of the solution and helping people feel comfortable in dental offices and ultimately any medical office in their communities. And thank you for your patience. You know, this is something totally new and we're building it together. I see you guys as partners in building something new. And so we're sort of driving the bus down the street as we're changing the wheels. And the hard part about that is it's a bumpy ride sometimes. But the good part is you get to have input in how it's going and that we really listen to your experience. And so please give us input. If something's working well, if something's not working well, we see you as our partners, And we want to hear from you so that we can continue to improve what it is we're bringing out into the community. We're going to learn so much together, and we're really excited to have folks like you in the mix. I mean, it's such an honor to have your expertise and your talent out there changing the world. So thank you for your energy and your enthusiasm and your input and all of those things. And together, this is really going to be something we create that changes the world for people with dementia. So thank you so much.
I agree. Linda Wenzel, looks like you have a question.
I was just wondering, do you think this will be we'll be using the Zoom platform or in-person platform? What do you feel is going to be the?
That's a good question. And I'm actually going to send it to Michelle, because she's been the person reaching out to the communities and to the dental practices. And Michelle, do you want to just talk about what you've seen as the trend?
Yeah. It seems to me like, well, in-person training is always, I think, better if you can do it. I mean, the reason we even thought about doing Zoom at all was because of COVID, frankly. We were sort of forced into that. But for clinics that are hard to reach, potentially it could be an option. However, what I will say about clinics that are hard to reach is that they're also hard to reach via Zoom. This training is meant to be a team training. And so it's meant for everybody on the team to be a part of it. And most dental practices do not have a conference room with a screen where everybody can be in the room at the same time and interacting with you on a screen. They also don't have the capacity to all be on a computer at the same time. So even if you're thinking, oh, they'll all just be at their desk in their office and then they can still interact, but they're in their desk in their office. No, there's no offices in a dental practice. There aren't computers like that. That's not how they work. And so there is one clinic that wants to do it that way, and they do have a conference room that's set up for sort of telemedicine so they can do this. But I would say the lion's share of people that I talked with, whether they were in the cities or outstate, did not really have the capacity to have a training in this way. I mean, it could happen, and we offer it in case people want to do it. But in talking with people, most people want to do it in person anyway. And the obstacle, like the people who did say they wanted Zoom, it wasn't because they were too far away. It was I gave them that option because they were far away, but they just felt like it could work for them and they'd be willing to be our pilot site for Zoom. But they would have preferred to be in person too. I just wanted somebody to help us test it, and they agreed, and they were outstate. But there were several other clinics that are quite far from where Colleen lives that don't have capacity. And so, I mean, now Colleen says she'll drive to Litchfield. I was trying to be good to Colleen, but we know these clinics are interested. We could also wait until the next wave, and then we know they're interested. So those could be the first ones we reach out to. So I'm not so worried about it if they're not ready now. And there may be some that cancel or want to change dates that we can push to 2022 in our current group. So that was more than you needed to know. But does that answer your question?
Well, my concern is most of the clinics, and medical are, you wear a mask. So yeah. I just wondered how that's all going to, if you're not rolling it out until January 1, maybe you're thinking that we won't have to wear masks by then.
Well, that's a good question. And when we initially rolled it out, there was a mask mandate for the cities, including in health clinics. And Colleen wore a mask, and so did everybody in the group. They also have the chairs distanced, and they had clipboards that they wrote on instead of being around a table. Now, because this was earlier in the spring when we first rolled out, so it was right after they allowed in-person gatherings, but everybody had a mask on. By the time we got to Rachel, the mask mandates are off, and almost I would say everyone in healthcare settings is required to be, I mean, they're all vaccinated. And I would say if you're not vaccinated, you should definitely be wearing a mask wherever you're going, but certainly in a medical setting. But if you are vaccinated, everyone there is vaccinated. And I usually ask that. As I'm setting them up, I ask about their comfort level, about if they're vaccinated. I tell them if the trainer's Colleen's vaccinated, I'm vaccinated. So I share that information so that we can better understand what the right thing to do is and to make everybody comfortable. But you know, some of it's going to be your comfort level and talking with the clinic and negotiating what's the best way to do that. And of course, whatever's happening in the world in terms of what the state law is at the time, what's going on. But I will say that health clinics, both regular healthcare and dental care, they're all working together. They're in people's mouths all day long. They're vaccinated. They're seeing people in person and they're gathering as teams in person. And so are healthcare staff members right now. That could change, but right now that's what it is. But when we started, Colleen wore a mask. We talked about it. She probably, in the end, they were all vaccinated and so was she. It was probably okay, but because of the rules, we stuck to that and it worked. It still worked. Colleen, you can say differently, but it really worked. We still did the small group activities. I asked about that and said, well, if everybody's masked and 6 feet apart, how are we going to do small groups? How do you feel about us gathering for that? She said, we're sitting, you know, less than a foot away from each other in the dental office cleaning somebody's teeth. So for us, that's fine. We'll just keep our masks on and we'll huddle in small groups. So we went with that and everything was fine. I think, you know, COVID is a weird blip in our cultural history and we have to kind of roll with the punches with COVID and what it is from day to day, month to month, setting to setting. So does that answer your question?
I agree. And I want to add a couple things to that. Natalie had put in a question in the chat asking about, you know, the limit, I think, on what is it best for one clinic at a time? What if a group dental practice in a region wants to have a combined presentation? I think, in my opinion, most of it is based on what Michelle just talked about, you know, safety protocol. If you've got a big enough area and you've got 2 to 3 practices that all want to be in a space together, as long as you're following, you know, county or regional state mandated protocols, I think it's fine. And especially if you're going to Zoom that. However, the one thing that would make it a little difficult is that we really do want people to think about what's happening in their practice, right? Like in your building, what's going, you know, what do you identify as an environmental issue and in your practice? So you'd have to work hard, I think, to keep those people together. The people that are in a practice, you'd probably want them to be able to work amongst themselves and not necessarily interact with the other practices. Did you have a follow-up question about that?
Nope, that answered. I mean, I was assuming it would best work to keep it smaller with the individual practices, but as word gets out there about this, if we get that asked, and I also assume that, you know, you do want to have kind of limit for the conversation piece of it, of how many people are at, if you can, the presentations too. So,
So to address that, yes, that's absolutely right. And then Colleen, the presentation queen, is going to present at the Star of the North conference next spring. And they are expecting lots and lots of people. She will be teaching hundreds of people at once. But again, they are advertising it as come and sit as a practice. You know, they want people to come, the dentist, the hygienist, the whole office to be sitting together. So,
Yeah, I would say this one other thing is that Jen and I are working with Steve Schumann and the University of Minnesota to be able to host a live session with either one particular practice or, I mean, not live like in person, like a live Zoom session, and record that. And then the University of Minnesota actually we would just have that as an option that people could go just directly there, take the course, and then get continuing education credit. So there may be, we don't know if this will happen, but preview of coming attractions, we're working toward having an online version that's available if practices, if they can't do in person, or they don't have space to do it in person, but they want to do it via Zoom, or someone's not available in their community to train them, that they could go here and get CEUs and do the whole thing through the University of Minnesota's dental continuing education credit system. So we are working toward that, but I don't think that would be available until 2022.
for sure. But yes, and I'm glad you brought that up. And then just a follow up to Michelle's good information and your good questions. Thank you for those questions. The other thing I wanted to bring up is COVID, in my opinion, is even though it's hard to launch a program during COVID time, I think it's probably also more important now than ever, because in my opinion, a big part of what we're doing with dementia friendly dental practice training is lessening anxiety, right? We're trying to make it less anxiety provoking for people with dementia related illness, for the care providers, and for the dental practices, right? I mean, we want them to feel confident and comfortable in being able to interact with all of their patients. And so I think we're already kind of wired about going to the dentist, and now throw in all of those anxieties that caregivers also have about, going out right now, right? And if I get sick, what happens to the person I'm caring for? So again, I think even in our preparation with dealing with dental practices, I mean, it's a good reminder of how people are feeling about getting their appointments made at the dentist. And it's okay to bring up that we're in COVID times, and that the same kind of concessions that they have to make as a practice is, exactly what has to be done for their patients. And unfortunately, we haven't done dental virtual visits yet, right? Nobody can check your teeth through the screen. Does anybody else have any questions? Your questions are good and important. Colleen.
So just like Minnesota was the first state to bring Dementia Friends to the people of Minnesota, and now there are lots of 30-some dementia-friendly states, is there any interest in taking this curricula broader than the state of Minnesota?
Yes, the answer is yes. We need to road test it, just like we did with Dementia Friends and Act on Alzheimer's, and the many programs that have come out of the pioneering spirit of the Minnesotans. But yes, if this program is successful, and if people, which it all indications are that this is going well. I mean, the pilot went well. I think phase 1 is going to go well. The reaction from the practices is extremely positive, so I'm feeling that's a good sign. So we're moving forward. If we get through the first year and it looks really good, and our data looks really good, because we are evaluating this, then yes, we'll bring it to Dementia Friendly America. And just like they adopted, I mean, Dementia Friendly America was basically just the nationalized version of Act on Alzheimer's. I know, because I rewrote all the medical tools for a national audience. They just took our stuff and brought it national. And I think the same thing will be true for this curriculum as well. I don't see why it wouldn't. I don't think there'll be any resistance to that. And there is nothing available like this or the advanced training that's being created for dentists. This is really the first of its kind, and it's so needed. It's so needed. So I don't see why it wouldn't expand out to a national audience.
I agree. Well, I appreciate you all giving us this much of your time because we know how busy you are and we appreciate it very much. And again, feel free to reach out with any questions or concerns. I will send out to all of you the dates that we have for scheduled training so that you can look it over and then reach out to Michelle and me about possibly sitting in on those sessions. And if you have any other questions, don't hesitate to reach out. But again, thank you so much.
Thank you, everyone.
Colleen, you can hit the record button.
Bye, you guys.